A journey for Dclinic, so Bali holds special memories. But last year we were just getting into developing our market and our business in Indonesia. Today I'm going to talk about some of those developments. Contracts provide the bridge for blockchain, but also for consumers to engage. So the theme of my talk is healthcare needs blockchain. So Dclinic is the first dedicated healthcare blockchain company to implement its private health blockchain, its PHB. And that is at the core of Dclinic. We are a technology company in the first instance, but we are also in the business of developing premium health and wellness vitality facilities and centres. And what we want to drive and deliver is improved health outcomes for care teams, consumers, and most importantly, governments. And Dclinic will deliver this through our technology platform, our PHB, through our premium vitality facilities and services, and through making the consumer at the centre of their care team. For us to be successful, and the planning that's gone on over the last 12 months to develop our products and services, particularly focusing on Indonesia, we entered into an agreement with Deloitte, Southeast Asia, over 12 months ago. Deloitte is providing us with governance, corporate governance services, and also providing PMO services for a number of the projects we're doing in Indonesia. Why does healthcare need blockchain? Here's a few graphics provided by Deloitte. And if you can see here, the actual growth in healthcare expenditure is enormous. It is outstripping GDP in 13 of the 14 APAC countries. Healthcare spending has increased from around 2.4% to 7.5%. It's predicted to increase by over the next 5 years. And the cost of disease in terms of disease prevalence has doubled since 1990. So the bottom line is healthcare cannot sustain the current trajectory of demand or costs. In terms of predictions, as Oscar said in his presentation, we are living in the digital transformation age, and blockchain is definitely at the core of that. But in terms of where Dclinic feels its sweet spot is, and where we're really targeting, is we see data as the new healthcare currency. And our blockchain platform has been built around capturing data at all levels, including an advanced clinical data repository using OpenEHR standards. We are also seeing that there is so many new entrants into the market for healthcare, and the boundaries between the different stakeholders have changed. So across the board, you're seeing new technology, new innovation, whether it's in pharmaceuticals, whether it's in biotech, it's transcending the traditional barriers and boundaries. So in terms of where Dclinic's been focusing, over the last 12 months, we've been certainly engaging governments. And Indonesia, we have had very good engagement with the Indonesian government. And we know that governments cannot keep spending trillions. Governments also are prepared now to make changes in regulation and legislation, as we heard from the previous speaker or earlier on today. And governments are wanting to create ecosystems, integration systems, so that all players across the sector can participate. And governments are funding acceleration of projects, proof of concepts. And I suppose the best example of this is that in July of this year, Dclinic signed $140 million USD contract with the BB Batam Authority and RSPP Private Hospital to implement the Batam Medical Blockchain Program. And that program is now underway, and it is the biggest blockchain healthcare project in the world today. And we see it's a win-win situation. It's a win for government, it's a win for private enterprise, it's also a win for the consumer. And governments will save money, but consumers will profit. We see smart contracts as the new game breaker, and as Oscar said previously, to cut down all the intermediaries and to make a streamlined system that enables verification, enforceability, digital verification. Smart contracts will allow high volume transactions to occur without no third parties. And we've seen over the last few years the issues with third parties and the problems with data manipulation, data being hacked. Guess what? Blockchain, it solves that problem. And the fact that you can do a transaction from A to B 10 times as fast, 100 times as fast, the data is protected, there's a good use case. Dclinic, as part of our vision, we want to engage consumers and clinicians to deliver better healthcare, better wellness, vitality programs. And what we are proposing is to use our utility token to reward consumers if they meet their health targets and their wellness targets. For example, if they eat well and they're on a special plan, diet plan, and they achieve their targets, then we will reward them. Similarly, if they do their exercise program that their doctor or their physiotherapist has set for them, we will reward them for that. And what's more, we know in the world today, most healthcare and care and support is provided by family in the home. Family, relatives, mothers. We will also reward them, because if they help the consumer achieve their healthcare targets, we will also reward them. Dclinic is reserving 40% of all its tokens for its reward program for consumers, clinicians, carers. So smart contracts, why are they going to become the norm? Because you have complete autonomy. No one needs to rely on a broker, a lawyer, or other intermediaries to confirm. Your documents are encrypted on a shared ledger. There's no way that someone can say they lost it. You can't lose it. Backup. Blockchain offers and smart contracts offer the best backup you can have because it's distributed and it's easy to replicate. And imagine if your bank lost your bank account details. Safety. Data is totally encrypted on the platform. It cannot be hacked. It cannot be interrogated. Speed. This is one of the big advantages of smart contracts because it eliminates all the manual processes and it facilitates point-to-point transactions. And it's going to save money. Look at the people now that are saving money using even digital transfer finance, like transfer wires or that, compared to the traditional banking system. They're saving 70–80%. And automated contracts are not only faster and cheaper, but they reduce errors. So what is Dclinic's philosophy? And this is our CEO, Dr. Richard Sator, who presented last year. And his name is Richard, but we've come up with this acronym, RICH. So we believe that blockchain technology creates unique opportunities to reduce complexity, implement smart contracts, create secure and immutable information, and create host-trusted collaboration. And I'll just give you a few examples of how Dclinic achieves this. So in terms of reducing complexity, I'll just bring these up. Consumers will be able to access their real-time data to get the best health care outcomes. What that means is on their mobile devices, on their computers, via the internet, they'll be instantly able to access up-to-date data about their care plans, about their current treatment, about their wellness programs. And the clinical community, all this can be delivered even to the consumer in their home. They don't have to be in a clinic, they don't have to be in a hospital. It can be delivered mobile anywhere. Implementing smart contracts. So this is where our concept of our rewards program has been developed. And what we want to do, the patient needs to be at the centre of their care. Being their doctor, my patient has responded positively to my recommendations. The nurse, I reminded my consumer of his tasks. My wellness advisor, he completed a patient survey to collect feedback and that my doctor acted upon. We helped Dad adhere to his vitality plan. I'm glad I could help with your recovery. This is where we see smart contracts operating at the consumer interface for consumers to benefit, take ownership for their wellness, their health, but at the same time, get rewards for doing good things. And I did my walking today. And Dclinic has already designed our consumer apps. This is what the consumer will see on their mobile phone. And it will tell them what their current rewards they've accumulated and for what activities. And at any point in time, they can see, effectively walk around with this, and under our vision, these rewards can be used in any of our services, to buy services, to get access to priority waiting lists. But in the future, we also see these rewards being able to be accessed at other service providers. So we create a health economy, a health catalogue of services. Creating secure and immutable information. This is at the core of healthcare and blockchain for healthcare. We will capture through the Dclinic PHP huge volumes of data. That data will be safely stored, encrypted, but most importantly, it can be analysed and interrogated for multiple purposes. And I'll go through a few of these now. And by the way, two of these are part of our team. Ishu, she's our legal advisor, and Kanika is our HR workforce advisor manager. So what can we do with this information? We can support evidence-based healthcare outcomes. Governments and healthcare organisations can reduce healthcare costs. Pharmaceutical companies can conduct safe clinical trials of their products. Insurance companies can be precise in determining what services are appropriate for their customers. And imagine for an insurance company, if they can see your vitality program that you've been maintaining and you've been the core of Dclinic. It's about setting up host trusted collaboration. And what do we mean by host trusted collaboration? It means that I, as the consumer, through consent, can make my information available to whoever I wish to see my information. And what's more, every time someone accesses that information, there is a record created to show who has accessed your record. So this overcomes a lot of the concerns around privacy, consent, and meeting regulations. And essentially, my care team can act on information. Any of the care team can go on, look at my records, see what my history is, see that I'm being managed for a complex problem. And once again, this shows you the tasks that are being set by the care team and the recommended to open up the consumer app, the Dclinic consumer app, there is information. And over the last 18 months, Dclinic has focused on developing our business in Indonesia. Indonesia is our launch pad. We see it as a big opportunity because of a multitude of factors, but one being obviously that the government is very pro digitisation innovation. In Batam, we've been encouraged to go to Batam because the government wants to make Batam a centre of excellence for digital innovation. 12 months on building our community, what we call our community of followers. And we now have around about 150,000 followers on our social media channels. And very soon we are going to list our Vic Vitality utility token, and we're looking to do that in the next 4 to 6 months. And we've been working with a number of exchanges to look at what is the best options and pathways. But Dclinic is proud to be working in Indonesia. Bali is where we started our research. We've got projects now going in Jakarta and Batam, and we've got future plans for other major cities. And my parting message would be the difference between Dclinic and some other service providers in this space is we encourage other service providers, other technology companies to come and join our ecosystem and be part of our ecosystem. We don't see us doing everything and being everything to everybody, but where there is innovative products, where there's innovative services, we are open for business, and we welcome people to come and talk to us about how you can become part of Dclinic's healthcare blockchain ecosystem. Thank you.